Can positivity help people or patients heal faster? I'm Dr. Michael Lee and pain performance consultant. Thank you so much for being here today. And you're probably thinking, that's an interesting question. Well, the answer may surprise you because just think about it. When people actually have positive thinking, right, generally their energy is better, right? But if we look at the other side of the spectrum, we see people who've got negative energy or destructive energy or just really grumpy or really depressed. Let me ask you a question. When you've met someone like that, do you want to hang out with them? The chances are is no. And I think about it this way as well. If you're grumpy and really like negative, do you think people want to hang out with you? Probably not either. But you can see there's kind of this environment is actually being created by the person. And when we look at if positivity can actually help someone heal faster, from my point of view, I don't believe that in terms of physiology, from someone just thinking, oh, I feel great today, and suddenly all their pain and disease disappears. I don't believe that actually happens because it doesn't essentially get rid of any dysfunctions. But what I do believe is this. If they've got a positive mindset and they think of the right things, it gives them opportunity. And you're probably thinking an opportunity of what, Michael? An opportunity to get out of the cycle. The cycle of negative thoughts, pain, hopelessness, frustration, negative thoughts, pain, hopelessness, frustration. It keeps going round and round and round. They just need one positive thought to then completely transform their outcomes. Because the fact is this, is a very, very famous saying in psychology is this. Your thoughts create your feelings, and your feelings create your actions, then your actions create your results. But always remember that it started with your thoughts. The thoughts started. So whatever thought is in someone's mind, whether it's positive or negative, that will completely determine their feeling. And when they get the feeling, whether it's a positive or negative feeling, it will then create a positive or negative action. And of course, whatever positive and negative action will then create a positive or negative result. So what I'm hoping that you can see here is this. If someone starts with negativity, there's only one outcome. It's a negative outcome. But if someone starts with a positive thought or a positive beginning, it at least has the opportunity to have a positive outcome. So here's a challenge that I want to give you as a clinician, as a business owner, or whoever you're maybe watching this live here today, is that whatever thought you have is going to create your own feeling. It's going to create your own action or your own behaviors and then your result. And that's also going to influence the people that are around you, whether it's your team, whether it's your friends, whether it's your family. So as a clinician, you could also have very good positive energy, positive thoughts. Because when you give positive thoughts to your patients or positive thoughts to your customers, it then inspires them. It inspires them to actually to think, if you can be positive, even when we're in this doom and gloom, when this world is actually falling to pieces, and actually the cost of living has gone through the roof, and actually people are really suffering in the world. If you can have a positive thought in the midst of all this negativity in the environment, just by chance, maybe as a patient or as a customer, I could have a positive thought as well. Now, I want you to just think about it, is just from that one thing, do you think this is actually very powerful? Because what I'm not saying is this, oh, just be happy all the time and just be positive, because sometimes you may miss the, I could say, the logical thing or the obvious problems. And I don't want you to ignore problems and just be positive. I want you to be, yes, see the positivity out of every outcome, whether it's a negative outcome or a negative environment. Yes, see the positive things, because this is the thing. When I look at today's society, this is what society wants us to be, and this is what normal is in society. If you do 100 things right and one thing wrong, what does society focus on? It focuses on the one thing wrong, right? But what's sad is that it actually tries to ignore that 100 things right actually ever existed, and it focuses on the one thing wrong. So I don't want you to be like society. That's what normal is. It's a very destructive society. But what I want you to be is, rather than ordinary, I want to be extraordinary and think, oh, actually, I want to celebrate the 100 things wrong. But the one thing that didn't go right, yes, I'm not going to like be worried about it or fear it or actually emphasize how badly it went, because the fact is that the past is the past. It cannot change. But what I'm going to do is I'm going to actually take the positives out of it and reflect, and then see what I can learn from it to make sure it doesn't happen again. Because now that's a positive mindset and positivity that helps that person move forwards to grow and improve themselves. Because the fact is that if they never actually thought of that and they were very depressed about it and like, oh, I'm so bad, or I'm not good enough, look how bad my results are, that just fuels more depression, more frustration, more hopelessness. So this is where I want you as a clinician to also be role models, or as a business owner, be a role model. Think about it and think, actually, what's coming out of my mouth and my actions is essentially a reflection of what's happening in my own mind. So although yes, this topic today is about can you heal people through positivity, well, I don't think it directly heals them, but I do think that it indirectly does, because all people need is an opportunity. They need an opportunity to improve, because if you think about whatever problem there is in the world, there has to be at least one person that's got the solution to that problem. And if there's that one person that can do it, anyone else on this planet can do it too. And that's the encouragement I want to give to all of you, business owners, clinicians, that yes, you have a very important role to make sure that, yeah, give positivity, but don't give them a false sense of security. Give them positivity in terms of, yes, actually, if you focus on the positivity, you have these options, but you focus on any one outcome. But give them the choice. And once you give them the choice, they need to then